Hello, I'm Peter Chern from the Harbours Medical Practice, and this is a short video about anxiety. We're seeing more and more people coming into the surgery suffering with really severe and disabling symptoms of anxiety. So this is a video to try and find some things that can help you if you're one of those people. This is about the 10th time I've tried to record this introduction because I'm anxious about what you're going to think of me. It's just going to have to do. And it will need to do, because one of the principles of anxiety is that you've got to feel the fear and do it anyway. It's one of the most pernicious things about anxiety, that you think you're managing it by avoiding situations that make you anxious, but actually you never get those wins of feeling good about yourself from overcoming anxious situations. So you just feed the beast and you make it worse and worse. So feeling the fear and do it anyway is incredibly difficult to do, but incredibly important. Well, you can think of anxiety as really an inability to be in the present moment. You're either worrying about things that have happened in the past that you can't do anything about, or things that might or might not happen in the future. So things like cold water swimming, or just having a really hot, bitter coffee, just immediately flood the senses and take you into the present moment. You've really got no other choice. This is really, really cold. Well, they say that discomfort is the price of entry for a meaningful life. And if you're feeling anxious, you're certainly going to learn something, whether it's about the circumstances in your life that are making you feel that way or how to overcome it. You're putting yourself in these situations, whether it's from cold water swimming and the ability to control your breathing and do it anyway, or going for a really long, hard run. Think of that as going to the gym and practicing how to manage your anxiety. It's going to make you a better person. So every time you're anxious, think of yourself as heading to the gym, whether you want to go or not. I love this time of year. I've just run up this hill and caught this smell of the coconutty gorse. It's beautiful. If you're suffering with acute anxiety or even panic, there's only one breathing technique that you need to know. It's called the physiological sigh. Animals do it when they're falling asleep. It's really simple. It's just a forced inhalation through the nose as deep as you can. And then when you get to the top, a little bit more. And a bit more. And then sigh it out. Studies have shown that it's actually the most effective way of acutely lowering that sympathetic stress tone that's so prevalent if you're suffering with anxiety. So give it a go, practice it, and then you needn't worry about ever feeling anxious ever again. You'll know what to do. Coconut, lovely. Well, this is St Andrews. It's where I went to university. And when I'm here again, I can still viscerally feel what it felt like to be here for the very first time. I started here after a summer where my parents had got divorced, my dad had moved overseas, and I was leaving home for the first time. And I still can feel that pit of anxiety in my stomach. Looking back with the perspective of being a 50-year-old man, I had a wonderful, wonderful time here. And that anxiety was a normal emotion. It was a difficult time, a pivotal time in my life. That anxiety was a highlighter pen. This is an important time. Be careful with your friendships and your attachments. This is the start of your life. I really treasure that feeling now. And anxiety, it's a normal emotion, and learning to sit with it and understand what it's telling you is perhaps the most important lesson of all. Oh, it's not always this peaceful, is it? Anxiety is a normal emotion. is supposed to vary. I think of it as going up and down like the tide. The goal of managing your anxiety better isn't to stop it going up at all. It's just to reduce the intensity or the height of those tides, to avoid those spring tides, if you like, when the anxiety is so high that it might spill over into really disabling anxiety or even panic. So how do we do that? Well, I'm afraid they're all those boring daily habits that you already know about, but that could be so hard to do. Getting enough exercise, prioritizing sleep, eating healthily, avoiding drinking too much alcohol or caffeine. You know, these things are not going to help you when you're in the throes of a panic attack, but they are definitely going to make it a lot less likely to happen. And there's another new factor that might be the most important one of all. Well, I'm afraid it might be these smartphones. There's such a close correlation between time spent on smartphones and rates of anxiety and depression. It's beginning to look like it might be causative. Whether it's the constant connectivity, the sense that you're always on, the interruptions through notifications, or how we use social media, comparing our insides to other people's outsides, or the highlights reel of their life. These devices seem really bad for us. As a 50-year-old man, I have to keep my phone in a locked drawer at work to avoid looking at it. It's pathetic. But when I do, I feel such an increased level of calm and sense of presence in my life. I'm sure it would help your anxiety. So maybe stop watching this video right now. I think you'll feel better. Well, reframing your anxiety in a positive way can also really help. When we look at the neurobiochemistry of anxiety, it's really similar to excitement. If you're having to give a talk or a presentation, if you're in an exam or a job interview, consciously telling yourself, I'm not anxious, I'm excited, may seem a bit contrived, but can really help. I've always thought of myself as a slightly anxious doctor. I'm a bit worried about making a mistake or missing something. But whilst that might not be very pleasant for me, that's not a bad thing for patients, is it? The funny thing is, there's never really anything to worry about. We never even know whether an event is going to turn out to be a good thing in our lives or a bad thing in our lives. Yet we spend so much time worrying about what might happen. How often have you had that sense of anxiety when you're driving into work on a Monday, thinking it's going to be a really busy, difficult day? It turns out to be fine. What a waste of worry. And how often do you just pitch up to work expecting a nice day? It turns out to be an absolute horror show. You never know. There's evidence that even huge events in our life could become either positive or neutral, depending on how we think about it. There's evidence that 12 months after a spinal cord injury, people are just as happy as if they'd won the lottery. So, what are we worrying for anyway? Or has anyone ever told you that you shouldn't worry about that thing or this thing? I'm afraid you don't get a choice. Your brain is there to try and predict the future and keep you safe. It overprotects you. And whether you've got really big, serious things that anyone would be anxious about, or whether you're a bit older and you're worrying about the favorite type of ham for your grandchildren, it's the same thing, and your brain will create the same experience. So don't worry about what you're worrying about. It's all the same. I've stopped on my morning commute to go for a run, and I have not been listening to the news. It's really a reminder to not expose yourself to things that you don't need to worry about. The news is relentlessly negative. Media companies know that you're far more likely to be interested, whether it's listening or clicking on a story, if it enrages you or annoys you. So don't buy into it. listen to music, listen to podcasts that enrich your life, make you laugh. So much stuff you just are better off not knowing about. It's funny that spending a morning filming a video about anxiety has made me feel really anxious. And sometimes you just need to distract yourself to get out of your own head. Just do something different. I'm gonna stop filming and start seeing some patients. It's exhausting. If you made it this far, you're probably by now feeling exceptionally anxious. I think what's important is that there's no one-size-fits-all solution to anxiety. It's important to think of it as a normal emotion that you need to understand and to learn to sit with, rather than one that shouldn't be there. Hopefully this video can give you some ideas to feel a little bit better. Don't think of it as a toolkit. I hate the term toolkit, but hopefully something here will help, and I hope you feel better soon. Thanks for watching.